When you get to the hospital or birthing facility, you'll make your way to the labor and delivery unit where you'll most likely be triaged or admitted. You'll be assessed with some questions about labor so far, as well as have an internal exam. You may have had one of these in the office in late pregnancy, or perhaps this is your first. You can see that your provider will assess the cervical effacement and dilation, as well as the baby's position and presentation. If the baby's vertex or head down, and which way they're facing, which, believe it or not, affects the ease of delivery. The examiner will take note of the status of your membranes and the station of your baby, or how far into the pelvis the baby has descended. As you get settled in triage or your labor and delivery room, you'll likely be hooked up to a monitor, and 2 disc-shaped sensors will be affixed to your belly using a belly band or belts and some lubricating jelly. One sensor is to monitor your contractions and note contraction patterns. The other is to monitor the baby's heart rate and gives you an overview as to how the baby is tolerating labor. Sometimes the baby's heart rate needs to be more accurately monitored, which requires a scalp electrode. This is a tiny wire where the tip is placed into the superficial skin of the baby's scalp. This causes a small scab on the baby's head after delivery, which heals without much notice or care, but can be very helpful during labor and delivery. If you're hoping to ambulate or walk around in labor once you've arrived at your hospital or birthing center, you may ask to be monitored intermittently. This means you're hooked up to the monitor for a time, and then if the tracing looks good, you may be able to be disconnected completely for a time and be intermittently monitored, either by going back on the machine you were on initially or by using a Doppler to check the baby's heart rate periodically. Another option in some facilities is telemetric monitors. You'll still be hooked up to the monitor, but it's wireless, so to speak, so that you can move around the room or the unit. Speak with your provider about what your facility offers. This is also a good time to ask your provider at what point in the labor and delivery process will they be there at the hospital or with you. I often get questions about hospital tours. If you're someone who likes to know as much as possible before you get into something, a hospital tour could be a great way to learn about as many certainties or things you can control as possible, like where to park, which doors to use, where's the OR or the nursery or the post-delivery unit. Some people feel comfortable going in on the big day and letting the experience unfold as it will. This is a personal choice and something you'll want to speak to first with your partner and then with your provider or their office staff to coordinate a hospital tour if you're interested in one. Another thing to keep in mind is that while your provider is there to deliver your baby safely into the world, you and your partner probably have some idea or vision of what your delivery may or may not look like. Talk to your partner, discuss the birth, perhaps using a birth preference tool like this to spark discussions about things like who should cut the umbilical cord? If I need to have a C-section or surgical birth, will you be okay in the OR with me? Will you stay with the baby if we're separated? It can be helpful to have these discussions before you're faced with more emergent situations. Another thing to keep in mind is that even though neither of you have done this before, you still have instincts that you can trust. When faced with choices in the labor and delivery process, try to use your brain to make decisions. The B stands for benefits. What are the benefits or would be the benefits of something? R, what are the risks of this choice or intervention? A, what are the alternatives? I, what does my intuition say? Mom has been carrying this baby for close to 40 weeks, and your partner has usually known mom for longer than that. There's something to be said for time spent together and knowing each other in this process. And lastly, and not now, what if we do nothing? What if we wait till the next contraction to decide? Or 30 minutes, or 5 contractions? Do we have time to think about it? Labor is typically a longer process than most first-time parents expect. Unless there's an emergent situation, can you slow down and give yourself time to think and proceed without urgency or external pressure?